Hey guys, I'm Molly from All Healthcare Careers. I'm going to be performing step-by-step CNA skills to ensure your success on the CNA clinical skills portion of the exam. Before we get started, I'd like to show you this CNA practice kit that we put together for you to practice at home with family and friends. It will be linked down in the description along with a video breaking down exactly what's inside the kit. Let's get started. Before we start, I'm going to perform hand hygiene, 2 pumps of hand sanitizer. Before entering the patient's room, I will knock. Good morning, Mr. Smith. I'm Molly. I'm going to be your CNA today. Is right now a good time for me to collect your urinary drainage bag? Wonderful. Let me close the privacy curtain and get my supplies. For this skill, we will need a barrier, gloves, and a graduate cylinder container. First, I'm going to place down our barrier, and this is just to protect the ground to make sure if any urine were to possibly leak. So extra protection, the graduate cylinder, and my gloves. Before I start, I always want to assess the tubing for where the catheter is to make sure that I don't see any kinks, and to always be aware that I'm not tugging or pulling hard on the catheter where it could possibly dislodge the catheter. And it is connected to a non-movable part of the bed, which is good. Next, I'm going to get my gloves on. Then I'm going to assess the urine so I know what color it is when I'm documenting, to make sure that if I see anything that is other than the color yellow, I'll make sure to make note of that. Then I'm going to remove the port from the protective sleeve bag. Then I'm going to unclamp the port. And then I'm going to drain the urine into the cylinder. Once everything is drained, I'm going to then clamp the port, place it back into the sleeve, the protective sleeve, and then put it back onto the non-movable part of the bed, making sure that everything is nice and secure. Once I have collected my urine output, I'm going to cover it up with my barrier. Then I'm going to disperse of the urine into the toilet, making sure to note how much urine output I collected from the urinary drainage bag. 200 mLs. Then I'm going to disperse of it into the toilet, placing the cylinder in the sink. I'm going to disperse of my barrier and my gloves. I'm going to rinse out my cylinder. Try the inside and the outside. Getting another paper towel. To place inside the patient's closet, but before doing that, I will then perform hand hygiene. Once hand hygiene is done, I will take the cylinder, place it back inside the patient's closet. Mr. Smith, is there anything else I can do for you before I leave? Wonderful. If you need me, please use the call light. Exiting the patient's room, if you'd like to perform hand hygiene again, you can. 2 pumps, hand sanitizer. We hope you found this video helpful. For additional resources, click the playlist for more CNA skills videos, or try our 3 free-day trial that contains over 1,000 practice questions to ensure your success on the first attempt.